Hi, hello, welcome back. I guess I could call my return here. This video, I wanted to start this on Monday, and the only reason I didn't was as many of you who do follow me on my old account, it seems to have been disabled. It's all good. We got alternatives. But I'm really here because I'm doing this for those of you out there who have dealt with shame. I'm doing it for myself. This is about life. This is about death. This is about rebirth. This is about, and I'm really nervous about this. I'm going to tell you right now, because everything that's happened over the past month has brought up a lot of emotion in me. And ever since I've had my appendectomy and was in the hospital, I found that I could cry at the drop of a hat. And it's mostly because of the emotions that came up as a result. People can look at you and they can perceive and they can come up with all of these stories and narratives because of their own discomfort. Because when people judge you, and this is where compassion for self comes in, and even for those of us who do judge, and we all do it, we're judging because we have to make a choice, not necessarily judging to place blame or shame, or to make ourselves feel better about ourselves. The bottom line is this. Each and every one of us has insecurities. And most of the times we project those onto other people. So when we see something in someone that makes us feel uncomfortable, we tend to place a judgment to separate ourselves. But that discomfort we feel from somebody else or seeing whatever it is that someone triggers in something within us, whatever it is that they trigger within us is really about us. It's an opportunity. It's at the surface and it's saying, are you going to confront this or are you going to react to it? Because the response should always be, what is this telling me about myself? Whether it's somebody is skinnier than you, someone is disheveled and homeless and you feel bad because you yourself could never imagine yourself in that case. But you don't know their story. You don't know anybody's story. You only know your own narrative, your own life story and experiences. And that's all we know, and that's all we go on. We go on that based on our beliefs, our behaviors, and our patterns. All those habits that we have, that we blindly go through life without thinking about, are so unconscious most of the times. We're not actively participating in life. We're just going through motions. So during this time that I was in the hospital, I really came down to what was I doing wrong? Where did I fail myself? Because this is all about self-care, and I don't even like the word self-care, and here's why. Because it implies you're not doing it to begin with. How many of you feel shamed because you're not doing enough for yourself, because you're doing everything for everyone else? And the last person you're putting on the priority list is you. And then what happens? It builds up resentment. It builds up the knowing that you once again have done something versus what you know in your heart and soul you should be doing. And that we put ourselves, and I can only speak from the perspective of being a woman. As women, we are natural nurturers. We are multitaskers. We want to do it all and help everyone else. And a lot of times it's at our own expense. And a lot of times, again, it's projecting our story. And we want to be liked. We want to be loved. And we think if we do for others, they'll do for us. There's an unwritten rule in this country, in this conditioning that we've had, that if I do for you, you're going to do for me. And that's the biggest leader to suffering, is our expectation that someone is going to meet us where we met them. But you got to change that whole narrative, because you can only go based on your personal experience. And the idea that you have any idea about anybody else's experiences or their life is the biggest lie that you will ever tell yourself, that you have any idea what they're going through. Now, you can relate to somebody, you can have conversations and share experiences, but no experience is exactly the same. What I'm about to share with all of you, I'm going to go raw and real, because that's who I am. And I got nothing to hide. I've been in so much freaking pain, When I was admitted to the hospital and I called 911, and I'm going to tell you right now, this is about body awareness. And I tell you, I walk my talk. There are times I've dropped my own talk and dropped my own walk, and I will share that with you too, because I have nothing to hide. Okay, so the morning I was tossing and turning, I knew something wasn't right. I knew I was feeling into my body and it wasn't feeling normal. And I knew it wasn't just my normal IBS flare-up. So 911 was my only option in that moment because it was the quickest option. And I was scared because I didn't know what it was. And I had no answers, and I literally had to surrender. I'd never been like this before to this degree. I just knew it wasn't what I had experienced in my past. And I had to surrender to the fact that I don't have the answer. And I'm good with that. And I'm grateful for modern medicine. I'm grateful for Buddy. He was barking and growling and trying to protect me. He's my little protector. And over the years, he has been such a sweetheart. And he's grown real close to me. And so he was really like, ma'am, can you come get your dog? And I couldn't move. The best I could do was call him into the room until Tom showed up. So all of this stuff that happened was very eye-opening. And what happens? Most of us get to that death point for us to wake the hell up, right? People with cancer scares, what does it take for us to wake the fuck up? That's a straight out question. At what point are you going to really come back to what is it that you want to experience in this life? Are you holding back for the perfect moment? Are you stuck in it has to meet these conditions or it isn't going to happen? We need to stop this. We need to stop thinking that, when this happens, that will happen. When I get this, I can do that. These are conditional thoughts and behaviors. And all it does is keep us trapped in our routines, and we have to change things up from time to time. This was a total change up in my routine. I was extremely confident, doing really well with my new practice. I was feeling physically stronger, more confident. I was really excited. I had all these things, and I still do. I haven't dropped anything off my plate. I've just softened and decided to go slower and more calmly. And I want to tell you right now, please share this video. And the reason I'm saying share this video is because there's someone out there that's going to resonate with what I'm about to share with you. I'm going to go deep to the point where I'm going to take this off. I want to talk about the stuff nobody talks about. When you go in for surgery, your body changes. I'm 45 years old. This was the last thing I wanted for a birthday present, was to remove my appendix, by the way. Is to spend my birthday, the last 2 weeks of my birthday month, in the hospital. So share this video because somebody out there needs to see it and to feel no shame for what they've been through. I've always taken really good care of my body as far as I knew at the time, because as we grow, as we learn, and we implement the knowledge that we amass in life, the experiences, because life is about integration and experience. It's not about, let me go read a bunch of books, let me get a degree, let me get all this knowledge, but not actually apply it. Because this is the biggest problem in life. We've got lots of people talking, but how many are walking? How many people are taking the knowledge that they amass in their experiences and actually apply it to their personal lives? Instead of saying, well, I know this and I know that. And I'm not talking to anybody out. I'm just saying this because even I, in my past, I've always been a very tactile person. I'm an artist. I draw. I have to feel. I'm about my senses. I want to hear it. I want to taste it. I want to smell it. I want to see it. I want to touch it. I want to embody it. That's what life is about. And when your senses are fully engaged, and if you've ever watched any of my videos, then you're right in it. That is life. That is living. That is being present. The difficult part about this whole experience was knowing that I'm really big on working on my breath, is catching my breath again. Being able to breathe fuller again. Because they expanded my belly. All right, now we're going to get raw. This is the part where I take this off, and I'm going to show you. And unfortunately, a week ago, you would have seen a completely different body because I have been trying to get my body in shape. But here's the bottom line. And most people aren't going to show you this, people. They're going to wait till later, and they're going to tell you about it, but they're not necessarily going to show you. just like those people out there, you know, and I'm going to talk about the purple elephant in the room, because there's always one person out there that wants to make you feel bad. You got a boob job. Well, what's your problem? You know, you've got your priorities. I hear this shit all the time. I could care less what you think about me. Just saying. That's real. And you know why? Because opinions are like assholes, and everybody's got one. The problem with this country is everybody thinks they need to voice it, whether it's kind or not. That's where the bullying comes in. If you've got a nice opinion, you've got beautiful eyes, you've got a beautiful smile, share it. Be kind. Choose kindness, because kindness matters. And when it really boils down to life, we all want kindness. So why would we extend something we don't want in return? Because misery loves company. And those people who are out there pointing fingers at other people are the first people that are miserable inside, showing it with the fingers pointing back. This is about no blame, no shame. Honor where you're at no matter where it is. Whether or not you've had a baby, you've had any type of surgery, the body goes through changes, women. And people don't want to talk about it. My girlfriend and I were talking about, we want to do a video, and we'll do that soon too, about perimenopause. That, you know what? They don't talk about the changes that us women go through. They don't talk about all of a sudden your body's going through these heat changes, or, you know, things aren't feeling right down below, or, you know, you want sex but your partner doesn't want sex, or vice versa. You know, there's so many things that we women go through, and we're supposed to feel ashamed for that? Please, drop the mic. Done with that. Bye-bye. So here it is. This is almost three weeks post-op. 26th of August is when I had my surgery in the morning. It took them 2 days. 2 days to figure out I had appendicitis. Do y'all know what appendicitis is? So this is where your appendix is. It's at the very bottom of your large intestine. And in my case, I had retrocecal appendix. What does that mean? It means this wonderful little guy, this appendix, was tucked up under. It was obstructed under my large intestine. Oh, Danielle, I feel you. We need to talk about this stuff. This is the bottom line. We all need to talk, period. And stop ignoring what's going on. You know, we find solutions, and that's how women operate. Most women that I've been around, especially in my community, we're all about talking, and men don't understand it because we find our solutions through conversing. Women are more communicative, most of us. I can't speak for all of us. Whereas men are more like, you know, they talk more surface. I don't know too much because I'm not in the males realm, but here's where we're gonna go. And when I turn around, that's the part that I'm the most embarrassed by, because I admit it, I love my body. I'm a perfectionist from way back, but I've really softened over the years. Because if I were such the perfectionist I used to be, I would not be doing this video. I'd have to have perfect timing, and you know, the house would have to be perfect in order, and all these different things. I have learned to be kinder on myself and gentler because of all of the stuff that I've been through in my life. And because, you know what? The mind is not always so kind. So it's really about learning to be kinder on your mind and to recognize that no matter what you're feeling, it's not about feeling good. It's about getting good at feeling. Whatever you're feeling is okay. And when you can honor it to the point where you go, okay, I honor where I'm at because I'm meant to be here right now. I'm meant to feel this in this moment. And don't poo-poo on it, and don't try to suppress it or push it away. The bottom line is you're feeling it for a reason. Whatever you're feeling, accept it, embrace it, and go, you know what? I'm not feeling real confident in my body right now. Okay, so I have a patch on the side. I've got pain going on. I'm trying to work through pain management. I'm also going to share with you what I'm using to try to recover from all this. So I've had to incorporate, and I'm telling you, my Kundalini Yoga, lifesaver, Sitali Pranayam is a deep healing pranayam, and it really helps the body help heal. It's also a cooling breath. So what you do, for those of you out there who are dealing with any type of healing, you make a taco with your tongue. If you can't, you just breathe over the tongue like that. like you're sipping through a straw down the back of your throat, and then you exhale out your nose. But inhale long, slow, deep through the tongue. And this bypasses my pain points in the side, and then exhale out the nose. And you do that long, slow and deep. Oh yeah, and I'm still dealing with my teeth, by the way. Thank you, Carly, for pointing that out. Yeah, you know what? When it rains in my life, it pours. It's always been like that, but I don't want to attach to that story, because when we attach to stories, we just keep repeating them. You know, that is the irony of life. If we keep telling the same story, we keep living the same story. So what I'm here telling you is my experience and how I'm going to work my way up. Because guess what? It's life, right? It's death, and it's rebirth. And we're always going through some form of a cycle of life, being born, dying, living, and then dying and being reborn in some way, shape, or form. I mean, our body, our cells regenerate, our organs regenerate. What is it? 7 years, you're a whole completely new person based on all of the changes and the turnover of your entire system. So, all right. Sitali pranayam. And it makes the breathing, and see, my problem is my right side. They basically pumped me up with all of this gas. And I'm not that big. So, and I have a little bit, like I've still got bruising. You can probably see this bruising. Great thing for bruising, people. Arnica montana. Arnica montana gel. So what I did is I started putting it across here, because arnica is amazing. It will help you heal. Now, I'm not trying to put anything on top of my little scar here. This is the one where I understand they pulled out the appendix. They did a slit straight up from my belly button. It's impressive to see what they did. This other area right here that you see, this is a little scar. The actual scab and stuff fell off yesterday. I was kind of surprised at that. And the other one, it's a little bit lower than I care to share, but it's right there. That one, I was kind of like, really? You had to go that low? And they shaved me too. I was like, oh, thanks. They didn't finish either. Just want to say. I was looking down going, could have at least finished. I didn't have time to do anything. It's kind of like my armpits and my legs. It's like, could someone just do that for me? It'd be really nice. Because then you just feel even grosser, don't you, ladies? We're like, can I just get like a little hygiene here going on? All right, so this over here on my right side, I'm going to straight up tell you that my head was in the clouds when I was in the hospital. I did not know how all I was going to recover. I was still just in a space of just in the moment. And I was trying to move around because they kept on telling me I needed to move gas, and all those antibiotics constipate the shit out of you. No, pun intended. Constipate and keep the shit in you. Just saying. So I was discharged on the 2nd of September for the entire first week. I essentially was home, and my first thing that I started doing was cannabis oil. And here's why. Because it's the only thing I could fall asleep with. And I was not about to take those antibiotics. I was in the hospital for 10 days. So by the time I was discharged, I'd already been on an IV, and boy, this arm was swollen. This arm was so sore. I put arnica on this, and that got rid of the swelling and everything. But this whole area, because of the intravenous, the IV, where they put the antibiotics, you could still see the marks all along my because I'm so easy to see, all of my veins. Anyway, they had me on super high antibiotics. So I said to the nurse, I'll probably not do the Cipro, because when I was reading the side effects of this stuff, people are suicidal on these antibiotics. And it can brittle your bones, and you can have broken Achilles tendons and all sorts of crazy stuff. I'm like, oh yeah, because I need more problems. And I'm already dealing with teeth issues. So of course, bones, teeth. So I got some patches. A good friend of mine, hooked me up with some patches. And you're supposed to put it on a venous area, but I put it over here because I'm trying to get this right rib area. This entire side is so tender that it's hard to sleep. And just finding the right position, happy belated birthday, Casey, by the way, is not easy. I'm sleeping with my king size pillow, which fortunately is like just the right length of my body to hug on, and just rotating in bed because my bones get really stiff. But I'm really keeping it as clean as possible. So here's where we're going to go with all this. I am 45 years old, and if you've seen any of my videos before, and I've been called out about how skinny I am already, and so of course when I'm walking around after surgery, I get looks, and I'm getting all sorts of projections of those looks, and I'm like, wow. Shows a lot of insecurity in the people around me. Because as it stands, I know some people have looked at me and been, Lana, are you okay? You lost a lot of weight. And I'm like, yeah, I had surgery. And so like just the approach of the question, I admire my friends because they're not judgmental. Most of the people who know me know what has happened. Some people didn't know right away. But ultimately, when I got home, I was under 100 pounds. There's no doubt in my mind. That says a lot. And I was constipated on top of that. So my body, my stomach was distended so bad when I got home, and I couldn't move a bowel. And here's what I'm taking. First off, when you're on antibiotics, because anti is against life, biotics is life. Right? Antibiotics, when you break down the actual words, antibiotics are about killing life matter. Probiotics are about promoting them. So I'm on probiotics. I take 2 of these in the morning. Let me tell you, it moves things. And I'm on my magnesium glycinate. Now, I personally prefer this because it delivers it on a cellular level, people. Magnesium glycinate. And the thing about magnesium glycinate is it doesn't make you go like running to the bathroom, whereas some of those calm magnesium citrates will cause you to do. And so if I feel a little labored, you're going to notice my breath. All right, you can do a drum roll if you want. My arms aren't that bad, but you know what? I've always been, like my arms. My butt, when I was younger, and my sisters will tell you, was a lot plumper, and I'm having to go through my own body image issues right now. This is why I'm sharing this, because I don't want anybody to ever feel shame that you're not the only one, and that your body will bounce back if you trust and you treat it right. Don't go into self-sabotage. If you get like really down on yourself, remind yourself of all that you've done, that you've accomplished, that didn't take a day or overnight. You know that things take time. Patience, and be a patient. And here's the other thing I also want to share. You can be living with chronic appendicitis, I've learned, and not even know it. And I've been living with chronic IBS and stomach issues for years. And I asked the doctor, is it possible that this could have been what I've been dealing with? I don't know. He says only, time will tell, because as time goes on and my body gets back to going, okay, now we're going to make things work. Because here's the thing, this is a body trauma. I've had an organ removed from my body, so there's been a death, and the body's going, whoa. This is huge. What the hell just happened? How do we get back to normal? How do we get back to normal, people? So, essentially, what is normal? What is normal for you, not for other people? I'm going to tell you, I am 45 years old, and I finally got a glimpse of what my old lady body would look like if I myself did not take care of it. So, oh God, now I'm seeing people that I know personally. This is embarrassing even more so. But I want to share this video with you specifically for the body shaming aspect, because there are going to be plenty of people who will try to shame people about their bodies and have no freaking clue about their actual storyline because they feel uncomfortable and insecure about their stuff, that they're projecting it on you or me or whoever else. Because it's easier to deflect things instead of internally reflect upon them. Anything that triggers you, people, you gotta confront it. All right, so here we go. I'm not proud of this. I'm embarrassed, but I'm sharing it. Why? Because I know I'm human. This stuff right here, and it's not bad as it was like 2 weeks ago. Because literally I stood up and I was like, oh my God, what is going on with my butt? All right, so I don't think I'll be wearing a bathing suit anytime soon, but this stuff, this isn't even the purple elephant in the room. This stuff, I mean, I had muscle mass, that's what happens, is when your body goes through changes and it's healing, it will start reaching for fuel. And years ago in 2007, I had an injury with my cervical spine where I hit my head and was walking around and I had severe nerve pain all along my left arm. I was on gabapentin Neurontin. Worst stuff you could ever take, by the way, too. There's another thing. If you don't need to be somebody who suffers from anxiety. That stuff will give you anxiety. And I didn't know during the time. And I never really suffered with a lot of anxiety. But ever since then, sometimes I do. So for 4 months, I'm taking this stuff, and that stuff totally messed me up. And I was on steroids, of which I had to do steroids and all sorts of stuff for them to figure out I even had appendicitis. So, like, literally, everything's got flabby skin. But that's because your body eats the fuel from the fat first, and then eventually moves on to whatever else you got left. And your body will atrophy. Not extreme, it just depends on how much time. But everything's recoverable. This is the beauty and the blessing of this human temple, this body. We need to treat it like a temple. We need to be disciplined, a disciple to ourselves, and treat ourselves better. Now, what does that mean? Not shaming yourself if you forgot to take care of yourself, but making time, making appointments for you. This is one of the things that I'm not just saying and advocating it, I'm actually having to do it myself. And over the past couple months, I have been trying to gradually rehone what matters most to me. How can I recapture and regain my juju, my good juju? The things that really uplift me are being in community. Are being with my community, with the Kundalini Yoga teacher trainings and all the programs there, because I give back what I've actually received. And I also receive more as a result of giving. And most people don't realize the more you're willing to give of yourself, and I don't mean in a sacrificial, I sacrifice so much. No, it's to make sacred. The word sacrifice means to make sacred. And the first thing you should be sacred, to make sacred is your body, your mind, and your soul. If you are not good with that, you're half-assing it everywhere else. That is a true statement. We got to start at home. We got to start on ourselves. If you got to work on getting the flab, it's going to take a daily routine. It's going to take dedication and discipline. It's going to take patience with self. And I will tell you, you have to cultivate and learn patience with self and apply compassion. This stuff doesn't happen overnight. You can't just expect that your life is going to be all airy-fairy because today I decided it's going to be that way. I'm going to be all happy and life is perfect. No, the reality is you have to choose every moment. Choose happiness over being right or being the better ego or, look at me. It really boils down to what is it that you need for you? What is it that makes you happy? What is it that lights you up? And maybe that takes sitting down and journaling. That's what I normally do. I want to know in the comments, let me know if you have any suggestions or if there's anything that would interest you. What would you like to see me do? What would you like me to talk about? Because ultimately, I got nothing to hold back. I'm right here. I'm in your face. I got my scars out, and I'm willing to be seen for all of who I am. I was letting myself down in a lot of ways over the past couple weeks, and I'm sure it was longer. This year's been really difficult on me. This past year has been one of the most difficult years of my life. Between trying to find the ways to grieve properly losing my mom, and trying to find my way out of like just financial debt, and just making it month by month. I mean, I struggle. I do struggle. And I don't think any of us need to struggle. That also is a choice. And I personally choose no longer struggling. I choose to heal myself on all levels. I don't think money is a bad thing. I think that when you vilify money, it's just like vilifying your own personal value and worth. So I think the relationships between money, whatever it is you think, it is not the money that is evil. It's the people and how people choose to wield it. If they hold on to it like a miser, or if they, they try to use it to control and keep power over other people. Money is actually a beautiful tool. But we don't ever talk about that. The majority of people will try to eschew it off as like, oh, it's such a bad thing. And they're the same ones that want it. So let's not be hypocrites. You either like it or you don't. But even if you don't like it, you still need it. Some form of a currency. Even if you're bartering, we all have to find ways that work. And if we can heal ourselves from the inside out, we can heal our relationships to money and other people and everything else around us. But it's an inside job, and nobody else can do it for you but you. And that's why I'm trying to encourage this with other people too, is I want you to heal. And if it's all about me showing my, patched up body, which isn't that bad, but I really was on that point where, wow, okay, my body, it's going through a process. And it is a life-death process, because see, most people don't stop to think that appendicitis, it is deadly. And I could have died. I mean, I didn't, fortunately. I'm very blessed. I have nothing to lose in this life. In the end, it really boils down to honoring yourself when you're alive and not waiting till the last minute or feeling like you've almost died. I'm grateful to be home. I'm grateful to be back in my own bed. It really is about mindfulness. And I'm going to tell you right now, if you're not present with yourself in the moment and what you're dealing with, it will show itself in your physical body. Because, this is going to be my 4th round of Beyond Addiction, and this time I'm going through to become a facilitator specifically because when the body says no, it's a reaction to the fact that the mind would not let go. So when your body's saying no, it's because you didn't let go. You didn't learn to confront and process whatever it is that you're just holding on for dear life for. And you got to ask yourself, what in your life is worth that much to hold on to the resentment, the cancer-causing, death sentence, resentment, anger, frustration, because those are all the emotions that underlie dis-ease and discomfort. If you're angry with somebody and you can't articulate or communicate that, and you're just festering and it just building up, it's creating something going on in your body. And if you look up the appendix, I was not at all surprised to read what I read. And I was like, wow, that makes a whole heck of a lot of sense for me. So I'm just sharing the products that I'm using. I'm not trying to sell anything here. My sister had made some ginger turmeric when I was up at and this is what I got left of it anyway. But it's a tincture so that I can help. It is a tincture that can help with pain, especially. B12, huge. I love this brand personally. But you also got to make sure that you methylate properly too, because everybody processes these B12s differently. D3 serum, we are all deficient. I live in the Sunshine State. I have absolutely no tan left right now, but I don't want to chance the photosensitivity as a result of those antibiotics that I was on. Max B Nano, which again, this is another B vitamin. I'm taking, you know what, I actually found this on Amazon and thought, let me try this. It's K2 and D3. So I'm trying this particular new product because I'm curious to see if it works. It's by Sports Research. I think I bought stuff before from them, just in a different labeling back in the day. Like I said before, I'm a huge proponent for the magnesium glycinate because this helps me move things along, but my digestion is still trying to find its way. That first week, I'm going to tell you, was the most painful going to the bathroom. And the problem is, you can't apply pressure to your stomach from the inside out. So I was struggling to push a bowel movement that just didn't want to come out. And I was bleeding. Okay? Real statements. I mean, really bad. And then on top of that, you know, my moon cycle came, so I was on my moon cycle for a week up until before the full moon the other day. So these are real life changes and things that happen to everybody out there. That's why I said, if you know anybody out there that needs to understand about compassion and to recognize that if you see somebody, you have no idea about their story, don't create one. When you create a story for someone else, you've involved yourself in somebody else's life that you probably don't necessarily want to. And all that is a distraction from your own life. Because when we do that, we're keeping ourselves. We use all sorts of distractions. We use other people as a distraction from looking at our own shit. Whoa, did you see what that person did? Da 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 da. What does that have to do with you? This is what we need to ask ourselves every single moment. Why are we projecting all this judgment on other people? When in reality, we don't want it done to us. But we're doing it all the time. The question is, how aware or conscious are you of it? I have had to really humble myself. And I think I've shared this before in many a time in a video. Things like when I'm cutting, you know, I'm in the kitchen and maybe my mind is just thinking about somebody and something they were doing. And my mind's going, wow, that's really impressive. That person is really brave to do that. But I would never do that. And then I nick myself. Because I actually created a judgment in there. Because a judgment is you comparing yourself to somebody else. Nobody wants to admit that. But that's all that is. It's you looking at someone else and comparing your belief system, your personal experiences, preferences, and habits and routines. And you're really taking them and going, oh. And in a lot of cases, because we don't have a high self-esteem and worth, by doing that, all we're doing is trying to find ways to build ourselves up because we don't know how to just give ourselves credit for what we are, beautiful people, and doing the best we can in every moment. So I'm really here to just encourage all of you. I'm going to try to do this daily and give you an update. I've been walking. I am slowly healing. I am being very honest and honorable with my body. I encourage each and every one of you out there, if you are struggling, let me know in the comments if you have anything specific that you would like me to do or talk about. If you see something and you have a question about me, my body, and what I'm doing, I would really just, I open that up to you. I mean, my calves, my legs, I'm going to get back there. I'm going to be back to where I was. It's just going to take time and patience. I mean, come on, really? I mean, who's going to talk about this? I mean, come on, ladies. The last thing any of us want to do is turn around, look in the mirror, and go, what the hell is that shit going on back there? I'm serious. Like, really? Like, I stand up and I'm like, that's not my ass. No, it is right now. And it's okay. And I'm meant to feel this and be in this position right now. And I honor that. It's humbling. But sometimes we need to go to the bottom to build ourselves up even stronger. And that's what this journey I'm sharing with you is about. because ultimately I believe that we all have a gift, and I got plenty of gifts to share, and I think this is just one of them. It's scary. I love you too, Suzanne. Thank you. It's a scary experience to go through. I highly recommend, if you are ever questioning, but the pain is so real, please call 911 if that is your only option, and don't wait. I'm going to find out whether this was chronic or not over the next few months. I was told this is a 3-month full recovery. And I'm like, what? And I can only do little things step by step and not beat myself up for what I'm unable to do. It's just about patience. I'm trying to breathe. It's about compassion, self-nurturing, returning to self, period. Don't look at it as self-care. Recognize that there's an element to life that requires your attention to go within and see and ask yourself, what is it I need to take care of me today? And maybe you do that daily, first thing in the morning when you wake up. Journal it at some point, whatever it is, and then whatever comes up, make an appointment for yourself. Make an appointment on your calendar and make sure it dings and reminds you, and you take the time for you first. Because nobody else is going to do that but you. I don't care who's in your life and who tells you what. You're the only one who can be accountable for you. And with whether other people show up or not, that's on them, because we can only be accountable to ourselves. And I think that's the biggest thing that I've learned in all of this, is it's about taking personal responsibility, owning up and learning from your mistakes. And there's no shame in that, because only you can do it. Nobody should be pointing fingers at you. Only you can be accountable to you. You're not even there to be accountable to anybody else. That's the best advice I can offer anybody. And God bless any of you who are parents and have children, because I know that's a totally different element and environment. And God bless you if you're single moms or single dads or struggling as a single parent. Because I know if you had to go through this and go through that, trying to maintain a household in of itself is difficult. And as women, we tend to want to keep going and doing all the stuff we were doing before. So I'm just here sharing with you that ultimately, don't get to this point. Don't allow yourself to get to the point that you have to come to death, life or death. I actually have to admit this last little bit, and then I'll finish up. When I was younger, I would look around, and this is all of my life. And I remember my mom would say to me, I never want to be like those old bitter women. And then my mom, she had a little bitter side to her because of her experiences, and I understand, even though a lot of it wasn't discussed. With that, she also said to me one time, I actually do understand why these women are bitter. And it's really a shame, because there's so much to life. And my mom, despite everything that she had been through, would give her shirt off of her back to anyone, whether she had it or not. And I've always given back. I've always volunteered. I've always had some involvement in community, some way, shape, or form, in ways that I knew I could support, because that's all you can do. When you're involved in something, whether you're a volunteer or even if you're getting paid, it should be something you enjoy. Not just, well, this is what society says I should be doing. No, you got to trust this. You got to trust your heart and soul to guide you. And I guarantee miracles do happen. And I don't just believe in them, I rely on them. And that's what Yogi Bhajan says. And the reason he said that is because life is a miracle. And we are miracles. Look at this. Look at how we go from a little itty bitty fetus, actually even before that, look at our life cycles. They're precious, but we don't honor them like we should. So I love you all. Thank you for sharing. I don't even know what's going on with my fundraiser for my teeth right now. On the YouTube version, I'm going to add a video, just so you know. What does an appendicitis operation look like? Yes, I'm one of those people. I go on YouTube and I just figure it out. This is what an appendicitis video looks like. This is what laparoscopic removal of appendix looks like. I was like, whoa, that's pretty intense. Check that out. Oh. But ultimately, life is, and we are. So let's just be free, happy, and joyous. So have an amazing day. I am going to go teach my Kundalini yoga because I am back in the mix. My own personal practice has been slow and gradual coming back to it because my abdominals are still strong, but still tender on the side, and I don't want to overstretch something that, but I love you all, and thank you for reaching out. I have some cool things I need to check into, and I hope you have an amazingly blessed day. See you next time.
Removal of the appendix, called appendectomy, is performed when appendicitis is suspected. Right lower abdominal pain, fever, and elevated white blood cell count are common symptoms and signs of appendicitis, which usually occurs when a blockage develops between the appendix and the intestine. This leads to infection, swelling, and distension. If the appendix is not removed, it can lead to a life-threatening perforation or rupture. The only treatment for appendicitis is appendectomy, which is almost always performed on an emergency basis. Newer laparoscopic techniques require only tiny keyhole incisions or puncture wounds, which generally result in a shorter recovery period. Before your surgery, an intravenous line will be started. Appendectomies are done under general anesthesia, which will put you to sleep for the duration of the operation. A breathing tube will be temporarily inserted through your mouth and into your throat to help you breathe during the operation. A catheter may also be placed in your bladder to drain your urine. An uncomplicated laparoscopic appendectomy usually takes between 20 and 30 minutes. To gain access to your appendix, your surgeon will use sharp instruments called trocars to create 3 small holes or ports through your abdominal wall. These ports are usually located at your navel or umbilicus and in the upper right and lower left quadrants of your abdomen. Carbon dioxide gas will then be pumped through the umbilical port to puff up your abdomen so its contents can be viewed more easily. Next, your surgeon will insert the laparoscope through the umbilical port. Images from its camera are projected onto a video monitor in the operating room. Your surgeon will carefully examine the inside of your abdomen, confirming that your appendix is red, swollen, and needs removal. At this point, your surgeon will pass surgical instruments through the other 2 ports, grasp the appendix, separate it from the intestine, drop it into a specimen bag, and remove the specimen bag through one of the ports. After your appendix has been safely removed, your surgeon will instill warm, sterile salt water through one of the ports into the abdomen to cleanse the abdominal cavity and remove any traces of infection. The salt water is then suctioned out. Before removing the laparoscope, your surgeon will take one final look around for areas of bleeding or other damage. When the laparoscope is removed, a port valve is left in place briefly to allow all the carbon dioxide to escape from the abdomen. Finally, the keyhole incisions are closed with sutures or staples and covered with bandages. At the conclusion of the surgery, your breathing tube and catheter will be removed, and you will be taken to the recovery area for monitoring, where you will be given pain medication as needed. When you are able to drink liquids, your intravenous line will be removed. Most patients can leave the hospital within 24 hours.